All right, let's just jump right into this. Welcome to The Explainer. Today we're unpacking a really shocking, systemic friction within the healthcare system that is quietly keeping people completely trapped. I mean, just imagine this for a second. You're recovering from an illness, your doctors come in and tell you that you are officially medically fit to leave the hospital, but then you find out you simply can't go home. You are physically stuck there. It sounds like some kind of bureaucratic nightmare, right? But as we look at the data and the first-hand accounts from a recent BBC News investigation, it's a very real, incredibly complex gridlock. We're going to break down exactly how this intersection of budget pressures, clinical safety protocols, and personalized care has somehow created a situation where perfectly healthy people are just stranded in hospital rooms. To really wrap our heads around the sheer scale of this issue, we have to look at the actual people behind the numbers. Meet Lucinda. She was admitted to the hospital with pneumonia back in April of last year. Now, she had a few health setbacks while she was in there, sure, but she fully recovered. By autumn, she was completely ready to be discharged. Yet, incredibly, Lucinda has now been trapped inside a hospital room for over a whole year. That's a full year. She is perfectly medically fit, but she is absolutely unable to leave.
And her situation isn't just some rare, isolated incident. Take Ravi, for example. Ravi is 36 years old. He went to the hospital for what was supposed to be a completely routine appointment, literally just to fix the settings on his ventilator. The doctors have said from the very beginning that he is medically fit to go home. But Ravi has been stuck in that hospital for 8 months. 8 months for a routine check. So naturally, this begs a massive question. What exactly is holding them back?
Well, let's dive into part one, lives put on hold and the people behind the delays.
Now, what's really interesting about this comparison is the stark, heartbreaking contrast. Before this gridlock, these individuals had incredibly vibrant lives. Lucinda is whip smart. She was literally studying for a master's degree. She's a gamer, a bird watcher, and a massive petrol head. Ravi is a university graduate who spent his time working for a charity. They had full, rich lives, but they both also require a significant amount of daily support to live those lives safely at home. Because that necessary home support is currently disputed or just plain unavailable, their lives have hit a brick wall. Instead of studying or working, they're confined to hospital beds, physically deteriorating from the inactivity, and describing themselves as feeling like they are just rotting away.
The emotional toll of this kind of stagnation is just devastating. While she was waiting to be discharged, Lucinda was suddenly told she was being sent to a nursing home, not her own house. Even though she explicitly stated, "I don't consent to this," her wheelchair was simply turned off and she was wheeled away anyway. She spent just 2 days in that nursing home before ending up right back in the hospital, where she's been stuck for months ever since. Living far away from her loved ones and feeling totally stripped of her autonomy, she basically asked, "What is the point of my life?" She feels like she's being treated as if she has absolutely no value.
And Ravi echoes this exact same profound sense of despair. He said, "I feel like I'm just rotting away for no reason. The life that I have is just getting shorter and shorter every day." Now for Ravi, this is not just a metaphor. He has Duchenne muscular dystrophy, which is a condition that will fundamentally shorten his life. So every single day he spends medically fit but trapped inside a hospital room is an unimaginable loss. It's literally robbing him of the precious time he has left to be out with his family and watch his nephews grow up.
Which brings us to part two, the care board conflict, cost versus clinical safety. So who is actually pulling the strings here? We need to talk about integrated care boards. Let's clearly define what these are so you instantly understand who holds the decision-making power in this whole gridlock. Integrated care boards, or ICBs, are the local NHS bodies tasked with a massive responsibility. They have to organize, fund, and secure viable, long-term care solutions for patients like Lucinda and Ravi. But here's the kicker. They are operating under severe, real-world budget pressures. Lucinda's case falls under the Sussex and Surrey Integrated Care Board, while Ravi's is handled by the South East London Integrated Care Board. Essentially, these boards are the ultimate gatekeepers to a patient actually getting discharged.
So, let's play neutral arbitrator for a second and look at the opposing viewpoints. On one hand, we have the patient's needs. Before his hospital stay, Ravi had 2 personal assistants supporting him around the clock at his home. Lucinda also had 24-hour NHS-funded support in her own home. The patients firmly believe that because this personalized care costs the NHS a lot of money, the boards are simply trying to push them into cheaper nursing homes. Ravi feels they see him as needing more support than they actually want to pay for. But on the flip side, we have the care board's stance. Ravi's care board strongly refutes any suggestion that their decisions are driven by cost. Instead, they maintain that their actions are strictly guided by clinical safety, governance responsibilities, and the absolute necessity to find a long-term solution that safely meets the patient's assessed medical needs. Lucinda's board similarly stated that her temporary move to a nursing home was strictly for her own safety.
But as you can imagine, this fundamental disagreement over what actually constitutes safe and appropriate care leads to severe friction. In Ravi's case, things have escalated dramatically. He's actually received letters from the NHS informing him that if he does not accept a placement in a care home, he might physically be charged for the time he's spending in the hospital. Wow. Furthermore, he was told that if he tries to self-discharge, all of his care will be completely terminated. Talk about being caught between a rock and a hard place, right?
So, the crucial point is really about the system under pressure, specifically a massive loss of expertise and resources. Let's get into part 3.
To really understand how this system is actually supposed to work in an ideal world, we can look to Frances Tippett. She's an expert in personalized care who worked for the NHS for many years. She explains that true policy-driven personalized care shouldn't just be asking, what's the matter with someone? Instead, it should be asking, what matters to them? It requires truly understanding their goals, figuring out what motivates them, and empowering them to be as well as they can possibly be, living the specific life they want to live, whether that means going out birdwatching or working for a local charity.
But here's the catch. Implementing that highly individualized care takes highly specialized staff. And this brings us to a really stark warning from Tippett. She points out that over the last 4 years, the system has rapidly bled the people with the specific skills and expertise required to arrange and manage this incredibly complex work. Without those dedicated experts available to facilitate these complicated home care packages, the system just kind of defaults to standardized options, like care homes, which, as we've seen, the patients fundamentally reject.
And honestly, the ripple effects of this lost expertise impact everyone watching this right now. Keeping medically fit individuals trapped in hospital rooms for 8 months or even over a full year just because their external care packages can't be organized is a wildly inefficient drain on taxpayer resources. I mean, think about it. As Tippett points out, literally nobody wins in this scenario. The patients are deeply suffering and public resources are absolutely not being used effectively. Now, to be fair to the system, when we look at the official response from NHS England, they do acknowledge the reality of the situation. While they didn't provide exact numbers on how many disabled people are currently stuck like this, despite being medically fit, a spokesperson totally recognized that the funding pressures are very real. They admitted that on occasion, delays do unfortunately occur, and they acknowledge that sometimes the outcome simply does not meet the expectations of the patients and their carers.
That brings us to our final section, the real human cost, becoming a line in a budget.
And this brilliantly illustrates the ultimate tragic friction of this whole issue. On one side, you have this sterile administrative reality, boards trying desperately to balance severe funding pressures, adhere strictly to safety governance, and find viable solutions on paper. But on the other side, we have the human reality. Ravi and Lucinda report feeling totally isolated, watching their physical health deteriorate from inactivity, and describing the entire process as inhumane and barbaric. They feel like their lives just don't matter, like they have literally been reduced to a line in a budget.
At the end of the day, if you strip away the incredible complexity of healthcare funding, the clinical governance, and all that administrative gridlock, the ultimate desire of these patients is incredibly simple. Both Lucinda and Ravi just want the basic, fundamental freedom to get back to their own homes. They just want their independence back so they can actually start living their lives again.
The system is clearly under immense pressure to somehow balance clinical safety and super tight budgets. But when the bureaucratic gears grind to a halt, it's real human lives that become the collateral damage. So, I'm going to leave you with this final thought to reflect on. When a healthcare system loses its ability to provide truly personalized care, and patients inevitably become just a line in a budget, who really pays the ultimate price? Thank you so much for joining me for this explainer, and I highly encourage you to keep questioning how the systems around us balance the ledger with actual human life.